Hi everyone, my name is Molly Fuchs, and this poster presentation is based on my capstone project that I completed with Advocate Illinois Masonic Medical Center as an MPH student at DePaul University. 80% of individual and population health outcomes are largely decided by social factors. This evidence led to the passage of the Affordable Care Act, which encourages nonprofit hospitals to go beyond disease management and consider the influence that social factors have on health outcomes. To understand these factors, hospitals conduct a community health needs assessment and create implementation plans to outline strategies to address needs identified by the CHNA. My project focused on the creation of implementation plans based on the health needs identified by Masonic's 2019 Community Health Needs Assessment. In creating a CHNA and implementation plans, the hospital utilized the Mobilizing for Action through Planning and Partnerships framework to facilitate the process as seen on the bottom left of my poster. Within the framework, this project focuses on identifying strategic issues as well as developing goals, strategies, and an action plan. To begin strategizing, the Community Health Department conducted meetings with community partners to discuss programs that address the priority health needs identified in the CHNA and determine appropriate indicators of impact. These meetings provided a space to work out details for implementing programs and determine how to measure impact of the programs with available data. As details of the collaboration solidified, the Community Health Department was able to begin drafting and ultimately finalize the implementation plans. As prioritized by the CHNA, the implementation plans focus on strategies to address behavioral health, social determinants of health, such as community safety and housing, and healthy lifestyles, such as obesity and food insecurity. The Community Health Department is working with community partners to implement strategies around these needs in the hospital's primary service area. For behavioral health, these strategies include increasing access to behavioral health services and providing education aimed at increasing mental health awareness and reducing stigma. For social determinants of health, these strategies include providing violence prevention services in the hospital's emergency room and contributing to the flexible housing pool. Lastly, healthy lifestyle strategies include providing a chronic disease management program, as well as providing food and nutrition education through food pantries and pop-up farmers markets. While each of these strategies have their own intended results, the outcomes associated with the creation of the implementation plans as a document include an increase in awareness and knowledge of the health needs of the hospital's primary service area, an increase in collaboration among community partners, an increase in programming that addresses community needs, and reduced emergency room and hospital readmissions. Ultimately, utilizing the implementation plans will lead to improved health among people in the service area. This intended improvement in health outcomes makes this project significant to the community. It's also significant to the organization because it fulfills the federal requirement that allows the organization to maintain their 501c3 status. This project also has the ability to contribute to practice-based knowledge by strengthening federal guidance on CHNAs and implementation plans in order to ensure the proper investment in community health. This project sought to advance health equity by addressing root causes of health issues. Root causes, such as social determinants of health, are driven by larger systemic forces such as laws and policies. Outside of this capstone project, the next step should be to advocate for deeper structural changes, such as changes in tax policy to better fund education, or an increase in minimum wage to further address health inequities. In conclusion, when creating implementation plans, it's important to understand the context in which health issues arise and develop strategies using a health equity lens. I would like to thank both Aisha Chessa and Nicole Edmonds for supporting the development of this capstone project, and I would like to thank you all for listening.